Even though the role of a firefighter is to attend incidents, go to fires and rescue people, we'd much rather prefer to go to an incident where somebody's already stood outside than have to go in and physically rescue them. When home oxygen's involved in a fire, it increases the risk to everybody. Obviously, because the oxygen's there, it increases the heat of the fire, increases the intensity of the fire and how fast the fire spreads. This also can affect everybody in the near vicinity. It affects the neighbours, it affects the friends, the families of the person involved in the fire, and obviously the agencies that have to attend it as part of the emergency response. That's the firefighters, the support staff, and the ambulance and police crews that attend.
Healthcare professionals, carers, people who work with home oxygen users have seen the benefits that using oxygen can bring. But not many have seen the devastating consequences of fires fed by pure oxygen.
In the days before the introduction of combustion-modified foam furniture, we would see room fires developing to full room involvement within a time of about 2.5 to 3.5 minutes. With the advent of combustion-modified foam furniture, we've seen those timescales increase 2- or 3-fold. However, if we start introducing higher levels of oxygen, we bring those timescales back down to those 2-3.5 minutes. As a fire investigator, I get involved in a number of fatal fires involving home oxygen users. It's a devastating time for the family, friends, and even the close community around these fires.
As the lead in one of the regions in the United Kingdom, we've been looking through the data of smoking-related incidents and fires, and we're finding it rather alarming, the number of fires that are attributed to smoking with patients who are on home oxygen. And I think you and I are on the same page. We would like to really stop smoking in homes, and maybe you've got some information on how big this problem is.
Oh yes, certainly. I mean, we've looked at our figures and compared it with yours, and of course those of BOC, and we're finding that around about one patient in every 1,000 is having some kind of fire or incident where they're ending up having to need medical treatment, or even in hospital, or sadly even fatalities. And that's per year, 1 in 1,000. And roughly 2/3 of those patients are because they've been smoking whilst using their oxygen. So yeah, it's a very significant number of patients, and of those patients that end up in hospital, around about 1 in 4 of them unfortunately die of their injuries. So yeah, you're quite right, it's a really serious problem.
And I think it all goes back to the way that we have to educate patients that you've got to stop smoking. One of the big things that I think patients must remember, if they do smoke, and we really are against smoking, but if they do smoke, that they must cease using oxygen for at least 15 minutes before going outside, because I think what patients miss is their clothing, their hair, everything gets saturated with oxygen. The minute they light up, they are potentially just waiting to be ignited.
Indeed, and I mean, some of the photographs you see have got some really horrific injuries on these people who've had these very vigorous localised fires.
I've worked long and hard with the coroner and other agencies to try and reduce the impact of oxygen-related fires. The only way forward to reduce these fires and reduce the number of injuries and deaths is to work in partnership with other agencies.
Professionals who work with home oxygen users have a key part to play in helping to keep them safe from fire.
Am I right to here on this one? Yeah,
If you're a carer or health worker making a home visit, for example, you have the opportunity to talk to them about safety and offer to contact your local fire and rescue service on their behalf for a home fire safety check. And you can keep an eye open to make sure that proper safety precautions are being taken. The sort of things that were covered in the opening section of this DVD, like the correct positioning of smoke detectors. You can make sure that the oxygen equipment is being used correctly, that the delivery settings haven't been changed, and that there are fire breaks in the tubing. You can satisfy yourself that the equipment is more than 3 meters away from open fires, gas fires, or portable heaters, and at least 1.5 meters away from heat-generating equipment or sources of static, like TVs. You can check whether oxygen cylinders are being stored safely in a well-ventilated space. And make sure that the person knows not to use paraffin or oil-based creams and liquids on their skin, since they can have an explosive reaction with oxygen. And you can monitor smoking, which is the cause of 70% of oxygen-related burns. It's not unknown for people to give up smoking in order to get home oxygen services, only to backtrack within a matter of days. So you should be vigilant. And of course, visitors need to know that if they smoke around oxygen users, they're putting their life at risk. They'll also need to be aware that their clothes and hair will be saturated with oxygen, so they need to allow it to dissipate for half an hour, as of course will you. Checking that fire safety precautions are being taken doesn't take long, and it could prevent a tragedy. So please, get into the habit of doing it on every visit. Should you see anything that gives you cause for concern, then you should do something about it. If you're worried about the patient's well-being, then seek advice from the healthcare professionals associated with them. Any concerns about home oxygen equipment should be raised with the supplier for your area, and, in addition, you should contact your local fire and rescue service. If the patient hasn't given consent for that, you can call the service in confidence and seek their advice, without divulging any private information about the patient. Always make notes of your concerns on professional paperwork relating to the patient. That could be vital if anything does happen and there's a full investigation. Don't keep things to yourself. Share your information. In the drive to reduce the number of deaths and injuries linked to home oxygen use, good communication between those who work with oxygen users, the fire and rescue services, and home oxygen suppliers is crucial.
Over the last few years, home oxygen provision has become a lot more mainstream, and it's really important for all the stakeholders to share information.
I agree. I think with the increase in new technology, patients will have more equipment at home and mobile, and maybe it's second homes. We make sure that we've got a really good inventory and all the relevant authorities clearly understand what equipment is there and how to deal with it.
Yeah, I mean, all the technicians, they go and carry out their own risk assessments as they're going into the patient's homes, and if there's any concerns that they have, they will, in most of the cases, address it there and then. Where this is not possible, we will wish to escalate our concerns with prescribers, it may be with the fire rescue services or other stakeholders, really ultimately to reduce the amount of accidents that happen.
Home oxygen users are vulnerable people. They're suffering from illnesses, and some of them may have additional disabilities such as mobility issues or learning difficulties.
As far as fire and rescue services, home fire safety visits or checks is concerned, the message to those that are delivering them is one of formulating a robust escape plan. Because the vast majority of these patients do have mobility issues, the fixing of a smoke alarm isn't going to help them escape from the property. What we would recommend is that a thorough and robust escape plan is formulated. Do they have a mobile phone easily available, and are they able to notify the neighbours if they do have a problem? Because realistically, if you're fixing a smoke alarm in a property where somebody has mobility issues, all that smoke alarm will do is make them aware that there's a possibility that they might die. What we need to do, as I say, is make sure that they have a robust escape plan so that if there is a fire, they can escape.
Are you seriously telling the truth?
If a fire should break out in their home, then the professionals dealing with the incident need to have as much information as possible, especially the fact that home oxygen is present, in order to respond effectively.
Unfortunately, there are times when people lose their lives in fire. In Merseyside last year, a 76-year-old woman lost her life. The 76-year-old woman was dependent on home oxygen. The 76-year-old suffered smoke inhalation, which was the cause of her death. She also suffered 75% third-degree burns. The conclusion of the report suggested that a cigarette was dropped on her bedding. By placing the oxygen mask on the bedding, saturates the material with oxygen. It becomes oxygen enriched. It is then thought that the individual dropped the cigarette. Because of the mobility issues of the individual, she was unable to get out of her bed. The fire spread quickly because of the oxygen. Unfortunately, the individual did lose their life. We have to learn lessons from these incidences, and we have. We've learned that we have to data share with people who supply the oxygen and other fire and rescue services across the country to learn from best practices. It has told us that there are profiles for certain people who may suffer incidences when using oxygen therapy. We must risk assess their homes. We must identify if there is any evidence of careless smoking materials. The profile is always the same. Somebody, bad mobility, living alone, probably housebound, and obviously, as we mentioned before, careless use of smoking materials will all add up to make this individual vulnerable to an incident involving oxygen.
For more information or to join the many partners working together to reduce the risk to home oxygen users, please contact the supplier for your region. Using home oxygen improves the quality of life for many people, but it needs to be used safely. Helping them do that and minimising the risk of fire should be everyone's responsibility. And if we all play our part, tragic accidents can be avoided.